regional South Australians cannot afford to lose any more primary healthcare providers than they already have. I reiterate my support for this motion and condemn the Malinaukas government for their short-sighted and grubby GP tax grab. In this current economic climate, any policy change that will result in an increase in the cost of delivering primary healthcare services cannot logically be pursued. To even fathom the imposition of cessation of the payroll tax amnesty at this point in time is frankly beyond belief. Did the Malinaukas government not get the memo that South Australia is facing an unprecedented ambulance ramping crisis? Have they not heard of the spiralling cost of living and cost of doing business that have seen so many SMEs go into receivership? Maybe they have overlooked the massive $700 increase to power bills in the 2 years since they've been in office. Whatever the case may be, it is clear to everyone, except apparently those opposite, that this is bad policy and nothing but a tax grab. Regional South Australia is already struggling to attract general practitioners, and it is obvious that this policy change will only further increase that difficulty. This tax grab comes at a time when Country Health Connect are withdrawing nursing services from towns across the southeast, such as Lucindale, Canalpin and Tintinara. At a time when, for the first time in living memory, Millicent has been unable to secure a registrar and has the lowest number of doctors in 50 years, following the recent departure of 2 registrars from the medical health clinic in Millicent. At a time when there is just 1 registrar available across the whole of the Limestone Coast right now, when there is, in the second half of 2023, we had 15 registrars for our region. For Millicent GP Dr James Bushell, he cites poor remuneration when compared with locum and specialist work as being one of the exacerbating reasons for this problem. Clearly then, when added, the impost of GPs cannot be sustained at this time. Mr Bushell is expressing his views over social media, and he wrote, and I quote, "If we lose just 1 more GP at the medical clinic in Millicent, it will be a disaster." Mr President, running a general practice is akin to being a small business owner. Everyone in this place knows how much South Australian businesses are desperately struggling with the rising cost of doing business right now, and to enforce payroll taxes upon GPs is a clear breach of faith with the South Australian community, whom this Malinaukas government promised in no certain terms prior to the election that there will be no new taxes and no tax increases. Mr President, data released in December last year from the National Rural Health Alliance shows that rural men are 2.5 times and rural women are 2.8 times more likely to die from potential avoidable causes than those in urban areas. Additionally, small rural towns of less than 5,000 people have access to almost 60% fewer health professionals per capita than those living in major cities. As the Royal College and the AMA have warned, the consequence of this government decision will impact the GP workforce. Older GPs will look to retire when younger GPs who wish to open their own practices will think twice about doing so, given the added impost.